Have you ever wondered how hirsutism in PCOS is managed? Today we're diving into this topic to shed some light on it. But first, let's take a moment to understand what we're dealing with. Picture this. Polycystic ovary syndrome, or PCOS as it's commonly known, is a condition that affects the functionality of a woman's ovaries. It's quite a common condition, impacting many women worldwide. Now, let's introduce a new term, hirsutism. It may sound like a mouthful, but it's simply a condition that results in excessive hair growth in areas where men typically grow hair, such as the face or chest. This isn't the usual light, fine hair that most women have, but rather thick, dark hair that's hard to ignore. Imagine these two conditions, PCOS and hirsutism, coming together. It's like a double whammy, isn't it? The intersection of these two conditions is more common than you might think. Hirsutism in PCOS is a frequent symptom, and it's primarily due to an increased level of androgens, which are, in essence, male hormones. You see, our bodies are finely tuned machines, with hormones acting as the messengers that keep everything running smoothly. But sometimes these messengers get a bit overzealous. In the case of PCOS, the ovaries may produce more androgens than necessary. And what happens when there's an overabundance of male hormones in a woman's body? You guessed it, hirsutism can occur. It's like a domino effect. One hormone gets out of balance, and it can create a ripple effect throughout the body, manifesting in symptoms like hirsutism. It's not just about the physical appearance, though. It's also about the emotional and psychological toll it can take. So there we have it, a snapshot of hirsutism in PCOS. It's a complex interplay of hormones and bodily functions, and it's definitely not something to be taken lightly. Understanding the root cause of hirsutism in PCOS is the first step towards managing it effectively. So, what causes hirsutism in women with PCOS, you may ask? Well, the answer lies largely with a group of hormones known as androgens. Androgens, including testosterone, are often labeled as male hormones, but it's worth noting that they're produced in both men and women, just in different quantities. In women, these hormones play key roles in regulating ovulation, maintaining pregnancy, and controlling bone strength, among other functions. Normally, androgens are present in women in low quantities, but in women with polycystic ovary syndrome, or PCOS, the ovaries produce more androgens than they should. This excessive androgen production leads to symptoms like hirsutism, which is the growth of excess hair, in places where men typically have hair, such as the face and body. Now you might be wondering, what causes the ovaries to overproduce androgens in PCOS? There are a few factors that contribute to this. First, genetics play a role. If your mother or sister has PCOS, you're more likely to develop the condition too. Second, insulin resistance is a common feature of PCOS. Insulin is a hormone that helps your body control the level of sugar in your blood. When your body becomes resistant to insulin, your blood sugar levels rise, prompting your body to produce more insulin. This overproduction of insulin triggers the ovaries to produce more androgens. Finally, inflammation is another contributing factor. Women with PCOS often have low-grade inflammation, which also stimulates the ovaries to produce more androgens. So, to sum up, the overproduction of androgens in the ovaries, driven by factors like genetics, insulin resistance, and inflammation, is the main cause of hirsutism in women with PCOS. While it may seem overwhelming, understanding these causes can help us find effective ways to manage hirsutism. So how can hirsutism in PCOS be managed? Well, the good news is that there are several ways to manage this condition, and it all boils down to what works best for each individual. Firstly, lifestyle changes can play a huge role in managing hirsutism. A balanced diet can help regulate hormones, reduce insulin resistance, and in turn, decrease excessive hair growth. Consuming foods rich in nutrients and antioxidants such as fruits, vegetables, whole grains, and lean proteins can make a world of difference. Regular exercise is also key. Engaging in physical activities like walking, jogging, or yoga can help maintain a healthy weight and balance the hormones, which can potentially lessen the symptoms of hirsutism. Medical treatments are another effective way to manage hirsutism in PCOS. Hormonal therapy, for instance, can help lower androgen levels and reduce hair growth. Birth control pills, Anti-androgen medications and other hormonal treatments may be recommended by your healthcare provider to manage your symptoms. It's always crucial to discuss these options with a medical professional to understand the potential benefits and side effects. In some cases, procedures like laser hair removal or electrolysis may be considered. These treatments work by damaging the hair follicles to prevent or reduce hair growth. While they can be effective, they're not without their drawbacks, such as potential skin irritation or discoloration. Therefore, it's important to have a comprehensive discussion with your doctor before deciding on these procedures. Managing hirsutism in PCOS can be a journey, often involving a combination of lifestyle changes, medical treatments, and in some cases, procedures. It's all about finding what works best for you and your body. Remember, managing hirsutism is possible, and you're not alone in this journey. Seek professional medical advice to find the best approach for you. This isn't just about managing a condition, it's about empowering you to live your life on your terms. Before we wrap up, let's quickly recap what we've learned. Polycystic ovary syndrome, or PCOS, can lead to hirsutism, an excess of male pattern hair growth in women. This can be caused by increased levels of androgens, a type of hormone. Managing hirsutism in PCOS involves a combination of lifestyle modifications, medical treatments, and potentially cosmetic procedures. With knowledge and the right approach, managing hirsutism in PCOS becomes a less daunting task. Always remember, you are more than your PCOS.